Hi everyone. A lot of you have reached out and asked me how chemo is going. And I answer whenever anyone asks, but I haven't actually posted about chemo. So I just want to try to talk about that today. I have had 4 treatments so far. Usually they're every 2 weeks, but the third one actually had to be delayed a week because my white blood cell count was low. And since then, my second kind of chemo has been reduced, and now my blood counts have been better. So anyway, tomorrow I go to the hospital for my 5th treatment, and somebody will drive me there because driving there isn't really a problem, but driving home, I am kind of dizzy. Sometimes my visual is a little weird, and my hands are doing weird things, so I don't really trust myself driving home. At the hospital, no one can actually stay with me. They've reinstated an old COVID rule just in January, so I just hang out by myself, take some coloring and some reading and some music, and it's fine. And I have 2 drugs that I get. The first one is intravenously at the hospital, and it's called oxaliplatin. That one has some weird side effects. So the most common one, I guess, is this cold sensitivity. So my hands and feet will tingle, and that can actually tingle to the point of hurting. And as my chemo treatments have progressed, it's gone from it's cold, it hurts to touch something in the fridge, to it can actually tingle at 21 degrees in the house, and my hands and feet are tingling. So can be inconvenient and weird. But also I can't eat or drink cold things. And the other that's neuropathy, but some of the other neuropathy that's happening is my hands are kind of get reduced in dexterity, they kind of claw in, and then I can't really write or text or things as well as I usually can. And it's not all the time. It will happen for little bits of time, and it will happen for kind of the first week after chemo. So the doctor doesn't like that particular symptom, and she's decided that she's going to reduce the other med that I like, the oxaliplatin, a little bit this time. So I guess both of my chemo treatments have been reduced now. She basically says it's I've been kind of overdosed, and so the effectiveness should still be good. It's just that they're not going to quite, they're not going to be attacking my body quite as bad anymore. So the other drug, they used to give it bolus, and we took the bolus out, but they still give it to me in this plastic bottle that it goes into my portacath for 2 days, so 46 hours. I wear it at home, and then Michael will take it out on Friday afternoon and put it in a waste bucket that we have. And that one is the one that kind of makes me nauseated, agitated, drowsy, and also even from when it first starts, have this weird, I don't know if it's a scent or a taste or an aura, it's just this weird sense of ugh, how I can describe it, and I feel it the whole 46 hours, and it's just, that's kind of strangely the thing I dread the most, I think, is that kind of feeling. Anyway, so but the nausea is under control with drugs. I don't throw up. I am kind of out of it from Friday to Sunday, really just in bed and drowsy and nauseated and not really able to do much of anything. And then I have fatigue, so that actually I'm not really able to do much of anything other days either. It's just I'm not really out of it the same way. Because I'll be able to do something small and then realize oh, I'm actually really tired and have to go lay down again. And with the fatigue, I also have brain fog, so that when you go to bed too late, you've past your bedtime, and you realize I'm about to fall asleep, and you're gonna have that fuzzy feeling of I'm about to fall asleep. I have that, maybe a little bit less, but most of the days. I don't have it right now. I had it this morning. I'll have it for most of a lot of time. So with that comes I don't always have the right words, or I might say the wrong words, or I don't remember something that happened, or I don't remember someone's name. And where my memory is usually really good, I get kind of annoyed by that. Yeah. So you can see that, like, I still have hair, right? Because different chemos are different. Like, so for colon cancer, patients usually don't lose their hair, it just thins, and it looks kind of like drabber or yuckier. So, and like, I get acne, and I also get like dry skin and brown spots. I don't know if those are going to go away. So I look less attractive, and if I am walking around in public, I'm walking kind of slow and look tired, but I don't look like a sick person. Like, someone wouldn't look at me and say, oh, that's a cancer patient. And it really makes me realize, like, just how much we don't know what's going on with other people, because I'm pretty sick. It's a stage 4 cancer. I was not really doing well with it, and yet it's still kind of invisible. So it's just something to remember, I guess, that we don't know what other people are going through. Anyway, I'm not miserable, right? This is not terrible. It's just, it's not fun. I'm really tired. I can't do as much. I kind of get a little bit sad sometimes, like, not really that sad thoughts, but like, just because my body's under attack, it's just kind of tired and sad. And yet, like, it could be so much worse. So, and I think a lot of chemo patients do have it worse. I feel quite lucky. And I still manage to get outside and enjoy this beautiful May weather, and I try to remember the good things every day. But I'm also, really tired and not able to do things, and I feel guilty about that and all that kind of silliness. So yeah, that's what chemo has been like for me so far. I will have, tomorrow's treatment and another one for sure. Then I'll do some scans, and we'll see if I have to have more treatments before surgery, or if we can have them after surgery. Yeah. Anyway, thanks for paying attention and thinking of me. And